Hello and welcome to part 2 of our presentation on COVID-19 and children living with rheumatic disease. I'm joined again by Dr. Pavla Walsh, consultant paediatric rheumatologist, who is responding to questions sent in from our consumers. This segment discusses comorbidities and COVID-19 in paediatrics. The first question, Pavla. My son has EDS. 2 years ago, he had a mycoplasma infection and was on high pressure oxygen for 3 days. Does this mean COVID-19 might be similar if respiratory infections in the past have been complicated?
Fair question. Now, EDS, for those who don't know, is Ehlers-Danlos syndrome. The most common form that we diagnose is the hypermobile type, and it's probably more common than we really recognise in the community. In and of itself, hypermobile Ehlers-Danlos is not recognised as having any risk factor for either catching COVID-19 or developing bad disease in COVID-19, or indeed any other lung infection. Mycoplasma infections, on the other hand, are notorious for having the occasional person that it hits hard. So it's not uncommon for somebody to end up needing oxygen for a couple of days with a mycoplasma infection. It's because it is a form of pneumonia. So to answer the question in a short form, no, we don't have any reason to think that a young gentleman with hypermobile Ehlers-Danlos and a history of mycoplasma infection should be at any higher risk of catching COVID-19 or developing bad disease if they get COVID-19.
Good. Thank you. Our next question, does having juvenile arthritis and joint hypermobility make a child more susceptible to contracting COVID-19?
Well, as I said, thankfully, nope. And we're very pleased that so far that seems to be the case. So children who are hypermobile don't seem to be at higher risk. And children who have arthritis don't seem to be at higher risk.
Good. Our final question, with vaccine for COVID-19 a long way off, the chances of children contracting the virus is high. How will this virus affect a young person with hypermobility as well as asthma?
So as I said, the hypermobility I'm not particularly worried about. The asthma might or might not prove to be of relevance. So there are some children with asthma who have very mild disease indeed, or indeed who've only had it in the past, who haven't had a flare of asthma for a long time. And then there are other children who have quite nasty asthma that is particularly triggered by viral infections. Now, at the moment, the word is chronic lung disease is a risk factor in COVID-19 infections. We take that to mean people who have pre-existing disease that actually causes trouble with the exchange of oxygen and carbon dioxide in the lungs. But we recognise children who have brittle asthma or children whose asthma is often triggered by viral infections might be more likely to have nasty disease. At this stage, we don't know for certain though. It certainly wouldn't be a reason that I'd suddenly be putting the poor child in an isolated room and not allowing them any contact with the outside world, but it would simply be something of which to be aware. Pay attention to your child's symptoms. And if they do get a cold and you know that they tend to get viral triggered asthma, make sure you have your normal stock available of their anti-asthma treatments.
Thank you, Dr. Walsh, for answering these questions on COVID-19 and comorbidities in the paediatric population. Just to remind our viewers, we have split this Q&A into segments so that you can select and view the areas of most interest to you. Please join us for part 3 in this Q&A session, which will explore infection control for children during the COVID-19 pandemic. Thank you.